Okay, my dear. Today we will speak about the cardiovascular examination. I will show you some presentation and we will follow it and get some information from here. How to change it on slideshow, I have no idea. I think like this. Okay, doesn't matter. So, first of all, how we begin our examination? Always, we begin from visual effect. So, inspection. You will look on your patient and take some information about what's happened with your patient. Cardiovascular examination. It means that we will speak about the heart, but why on this picture is given the part of the hand and face with changing in colors. Of course, my dear, it's very, very important, and I will give you explanation why. This blue color on the finger, as you see on the last phalanges, on the distal phalanges, will give you explanation about the blood, which is more um, full with CO2 than with oxygen inside. When blood is full of oxygen, it has a red color. And if it is bluish, it means that CO2, the product of expiration, is in our blood. So, if it is only in the hand, in the phalanges, it means that we have peripheral cyanosis. Cyanosis, it's name for this kind of exchanging. It's not exchange with the tissue, taken from the tissue CO2, but cannot deliver it to the lung, somehow stay in the distal part of the body. It can be heart disease, but as well it can be vessel disease. So, no, not full contraction, not full exchanging of the blood, not good blood flow in this part of the body. But when you see, and you see here on the right from me, I have no idea how it will be on you, your picture. So on the face, triangle between the nose and the lips. See here, my dear? Nose and lips. When you see this kind of triangle, what you have to think? You have to think about central cyanosis. It's more close to the center as you see, and this triangle, which is named as well triangle of death or heart triangle, give you explanations that something in the heart is not alright. So contraction of heart and exchanging of oxygen is not so full and so good. So if you see this kind of, first of all, you will think, is here weather changing outside? Maybe it's very, very cold and some contraction of the vessel exists, and your child, perfectly you find it in the childhood, in the child, has this blue lips, yeah, but if it is in any kind of weather and perfectly in the room and after some exercising as well, so you will think that must be checked heart, because in heart maybe some problem exists that can come from genetic, from embryological period, as well as something that must take place after the infection, trauma, and so on. Okay, so skin give you explanation about the exchanging of oxygen, and exchanging of oxygen is always connected with the heart pumping, and heart pumping is heart muscle contraction. Heart muscle contraction is the main function of our heart. So changing in color to bluish. It's kind of symptoms that must be taken in consideration with us. Another is pale color. Pale color is not bluish, it's white. So when person became white or pale, you have to think that patient maybe has internal bleeding. It means that somewhere blood is lost and we have not enough blood to color the skin of our patient. If color of skin perfectly on the face and hands are reddish, so red, not bluish purple but red color, so you have to think that it can be dilatation of the blood vessel. So blood with normal distribution of oxygen is coming close to the skin, so it became reddish. Understand? Yeah. So why it can be in the hot weather perfectly can be after exercising because blood vessel works hard with you as well. In some diseases, when you have fever as well, so it's not always is connected with the heart. Reddish color of the skin, but you have to compare these colors and take some ideas about the processes which exist in the patients. Next, here is some schedule given to you what we have to examine in the heart examination, but do not scared of it. We will do it very easy and interesting kind of cardiac examination skills. Its objectives for master describes the chest wall anatomy and identifies the key listening areas. Evaluate the jugular venous place, the carotid upstroke, pressure and absence of carotid roots. Palpate and describe PMI. Auscultate S1, S2 in 6 position from the base to the apex. Recognize the effect of the PR interval in ECG as well. So identify physiological and paradoxical splitting of S2, auscultate and recognize abnormal sounds in early diastole including and S3 and OS of mitral stenosis. Auscultate and recognize S4 later in diastole. Yes, here is a lot of given to perfect physician. And we will do only very common work, superficial kind of, to understand if something happens here, and then if we find something, we will do with cardiologists the more deep examination of this patient. So if you cannot recognize the split of S2 or late S4 or some other kind of murmurs like increasing, decreasing or other kind of paradoxical pulse as well, do not care. It's only the idea, is here normal or pathological kind of. And then if pathologic kind or not normal you will find, you can send your patient to the cardiologist to further examination. Now let's take the heart and remember the portion of the heart. So heart is not vertically as it is described in the some books. So not medical but common biological book. It's given that heart is hanging in the slightly left position. No. At first, look, I will find somewhere another picture. Maybe here, my dear. Here. Look here, my dear. So, heart is not in the middle side, is not on the right side, but as well, it's not perfectly on the left side of the chest. Where it is? It begins in the middle where the sternum is. Do you know what sternum? Chest bone. Yes, it's named in the people in social. So behind the chest bone, begins, and slightly go to the right, oh, excuse me, to the left side, excuse me for sure. Sometimes, yes, sometimes we have right cardio position happens. Sometimes it can be genetical after accident and after some surgeries as well, when some cancer surgery was done, so some changing can happen and heart can be taken slightly on the right side as well. For sure, I have neighbor who has, after the car accident, changing the position of all the inner organs, so his heart is right cardio position right now. Okay, so understand, not in the middle, not on the right, but from middle to the left side till the, see which line we have here, media clavicula. You know the clavicle, yes, take the middle side of it and slightly, maybe 1 centimeter goes farther from the midline. So it's media clavicular line that make us some border of the heart here. Okay, but where it is, so from position from medial to lateral, we understand. Now from superior to inferior, where it is. Heart is not going out of the chest on the neck position. It's perfectly behind the angle, which is done by clavicles and sternum here. Here is some notch, yeah? And behind this notch, you can check, you can press aorta angle of aorta. See, our aorta has curvatures, so this curvature can be seen behind the sternum on the superior position. So what about the lower border? As I say, heart is not hanging vertically or it will go to the stomach portion. It slightly go to the left side, yeah? So the position, the last position is the fifth intercostal. Fifth. 1, 2, 3, 4, 5. The fifth intercostal position is the low border of the heart. Understand? Yeah? Okay, my dear. Low border, we understand where it can be found. We understand where is the superior border. Yeah, upper border. Now, one more moment. Heart is not hanging, is not vertical, but look what's happened. It goes oblique from middle side to the left, from upper side down slightly, but as well it's torn. So if it will be vertical, you remember what we have inside? If we will cut the heart, we have two ventricles and two atriums. Atriums and ventricles are chamber, yeah, of the heart. We have four chambers for it, so four rooms. It will be one upper side, one lower side, right atrium, right ventricle, left atrium, left ventricle. If it will be hanging, it will be perfect. But our heart is slightly turned, so the right one is more close to the anterior part, and the left side is more turned to the back side, to the posterior side. Imagine, rotate it. So once again, heart is not hanging, is going oblique from upper side down, from right to left, and turned right side anterior, left side posterior side. So if you will take off these thoracic ribs, what you will find? More right ventricle, right atrium. If you will go from the back side, which part you will take? Not back side of the heart, but close to the back side, you will find left atrium and the left ventricle. Understand? So we have four chambers. Right atrium, right ventricle, left atrium, left ventricle. Right is more anterior, left side is more posterior. Okay. Now, my dear, what's happened here? See this purple lines here. So to the right side, by purple color, you see, it's vein. What is a vein, my dear? Remind me. Vein is a vessel where we have deoxygenated blood, and which takes the blood from tissue to the heart. Okay, and this red one, see on the more left side, it's a red one, not purple. It is arteria. The main artery of our body is aorta. So this is aorta, arteria, aorta. So this big vessel is aorta. What we have in the arteries? We have oxygenated blood full with oxygen, and blood is floating from heart to the tissues. Okay, so right one, collected bad deoxygenated blood, take it in the ventricle. From ventricle it was sent to the lung, my dear. In the lung it exchanged the oxygenation blood to oxygen. So change the CO2 to oxygen. Then collect all this blood from the lung, take it to the left atrium, then to the left ventricle, and through the ventricle, and it was sent to the all tissues and organs of our body by the arteries, and main artery is named aorta. Okay, what we have between the chambers of the heart, between the chambers of the heart must be some door, yeah, something must close it, or blood cannot be collected here. It always will be taken to the through the this passage, through this passing way to the ventricle, and it will be dilated, cannot afford, and so on. And when it will contract, some blood will go back to the atrium, and some problem will exist. This kind of problem exists when we have problem with the valve. So this door, this closure between the atrium and ventricle, see this part, it's open now, yeah, in our picture, is named valve. If this valve are closed strictly and normally, you will find the sound like drum kind of tam ta tam tam ta tam 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 ta tam. You can auscultate your heart, and you will find that these clear sounds exist in the heart. So what it is? Closing of the what is this? Valves. Where we have between the atrium and ventricle on the right side, between the atrium and ventricle on the left side, and can you imagine that here must be some valves? It's in the main pulmonary trunk, or when heart will contracted blood going to the pulmonary tract, to the lungs, will go back then, if not close here, yeah, pump, close. So blood cannot go back, and floating back of the blood is named regurgitation, dear. So it will not regurgitate here, it will stay in the vessel, and so by the pressure, by negative pressure, and so on and so on, and by pressure from the heart for new portion of the blood, it will be sent to the lungs as well. Here on the left side, when ventricle is contracted, it press this valve and opens this door to the aorta, and blood is going to aorta and sent to the organs. But when the ventricle is dilated after contraction, always is dilatation. So back floating of the blood can give you idea of regurgitation, and this regurgitation is very bad in cause it will give you extra blood in ventricle. So from atrium will go some blood, from the vessels will go the back floating of the blood, so dilatation will be to afford all this amount of blood, it will be dilated. Understand? Yeah, so we have to understand how it works. So now two ventricles and main vessels has their doors to preventing a backflow, which are named valves. Okay, let's go then. So we have to find out the point of maximal impulse. Yes, here you can see maximal impulse, known as PMI, point of maximal impulses. This is the location at which the cardiac impulse can be best palpated on the chest wall. Palpation. So after the inspection, we have to speak. We take some anatomy portion. Now, you have to remember that after the examination, always must be after inspection must be palpation. See on this picture, physician take hand on the place where perfectly the heart is. So the place where you can find the not heart but projection of the heart is precordium. So once again, what is precordium? Precordium is a place where you can find out some portion and some problems which exist in the heart and projected on the thoracic wall and can be found by you by palpation or auscultation. It's not right anatomical portion because we name some points where we can maybe auscultate the valve or tone or something else, but it's not the perfect place where this anatomical valve is. Okay, but where it distributes this tone. So what he do? He palpate thoracic portion. He palpate precordium. What he want to find out, of course, by inspection you will check if some pulse, some pumping can be seen. But you see this person has muscles, it developed in good manner, so maybe you will miss it. Yes, some palpation, visual palpation. But if you press your hand under your finger, you can feel this pulse, this beating of the heart, pump, pump, pump. It's not always good, my dear, to find out this pulsation on some points. Somewhere it must be find out easily, somewhere not. So where the best point you will find the palpation, and perfectly here you on this first, which one is the third, A, B, and C, excuse me, by the name of the pictures. You can find the hand below the what is this, nipple, yes, of the breast. Yes, see, finger, full hand, full hand. So here we will find the point of maximal impulses, maximal beating. So here you easily can find out pulsation by your palpation. But if you will find palpation in other parts of the thoracic wall, it is not good, and you have to notice it and take your patient for extra examination to the ECG or other kind of portion as well. So next one, my dear, what we have to do, we have to understand the perfect point. So perfect point of maximal impulse is one moment please. is in the mid-clavicle line, fifth intercostal. How to find, my dear? The first, take the chest bone, take the finger near, the first pressure near the chest bone is first intercostal. Then roll on some bones and you will find, so first, second, third, first, fifth intercostal. Follow fifth intercostal, take the position of medial clavicle line and you will find the point of maximal impulses here. Understand? Yeah, maximal impulses here. Okay, so why it's so close? Because as I say, heart is oblique, turned, rounded, and so on. So, and this point, this apex of the heart is very close to the skin and base is far from the skin. So the most close portion or apex is only 1 centimeter deeper the skin. So perfectly, if you want to reach the heart, you need some injection with a needle 1 centimeter only. So press here, make some point and take the needle 1 centimeter, you will reach the heart perfectly here. Understand? Yes, how easy it to damage here the heart wall. Okay, maximal impulses. Let's see then what we have to find. It is found on the left side of the chest in the fifth intercostal space at the mid-clavicle line. The apical pulse is also the location of PMI, point of maximal impulses, and is at the apex of the heart. So, what's then, my dear? Let's go further. This we find out here. Then I will jump over some portion in this PPT and then we will go back here. Okay. So after preparation, we have to auscultate our patient. Do you remember what I said? We say that we have some valves. You remember what's happened? Heart is slightly turned. So left side is more back position. Because of back position, left valve which must be on the left side, now aortic valve. So why? Because from ventricle it passed the blood to the main aorta, but in case it's turned right side up. So you can find the best point to auscultate of this left ventricle aorta valve, which is named aortic valve, on the right side of the thoracic portion. Understand? Yeah. So once again, it must be on the left, but because heart is turned right side up, so we find this aortic valve on the right in the second intercostal position. So if you will take the stethoscope here on the second intercostal, you will find out what's happened in aortic valve. What is aortic valve? Blood sending from the left ventricle to the heart will pass this valve. So if we have some problem with this valve, it can be seen on the second intercostal position. Then on the right side, second intercostal, so symmetrical to it, at the sternum, see this chest bone, sternum named, on the right side, you can auscultate pulmonary valve, which is pulmonary on the right ventricle, contract it and send blood towards the lungs. And lungs in the Greece is pulmon. So pulmonary valve is valve which give permission to go to the lung, but not back from this vessel to the right ventricle. So if we have problem with this valve, you will understand in which part of the heart we have some problem. What kind of problem? If it is not full, stick or it will be some regurgitation sound like something like this. So it means that blood is going back, like in the bottle, from bottle liquid is going to the to what, to cup maybe. Yeah, this kind of sound is regurgitation. Sometimes it's a perfectly murmur, like in the cats you can find murmur, this kind of sound. So all these abnormal sounds must be noticed by you, and if you notice something, you can send person to the cardiologist. Okay, now see anatomically tricuspid valve. It means that between the right atrium and right ventricle we have some door, yeah, valve. It's named tricuspidal here. Anatomically, you can see where it is. It's behind the sternum right now, but the best way to auscultate is on the left side in the fifth intercostal point. 1, 2, 3, 4, 5. Understand here, but perfectly can be found on the right side as well, but better to take it here. Okay, understand. Now look here, my dear. Mitral valve. Anatomically, it is somewhere on the position of the third intercostal. But for better auscultation, for better point of, you can take the stethoscope on the fifth intercostal where we have the maximal impulses. Yeah, why, my dear? Once again, I will show you one very interesting point of, if it is seen. Oh my God, come on. So anatomically, look, my dear, what's happened? Right one has thinner walls than left one. So when you take to the apex your stethoscope, you will find the tone which are coming from the left side, not right. Understand? So if you take stethoscope here, what you will find? The valve between the left atrium and left ventricle. Okay, so in this position, on the apex, you can find mitral valve, which is perfectly between the left atrium and the left ventricle. Get it? Okay. What kind of sound are normal, which are abnormal? No sound except some, like applaud by my hands, some sticking must be found here. If you will find additional sound, like normally it's but sometimes it's the third sound exists, yeah, or sometimes it's four sound. So this is additional sound which must not be here. If you find out, take the place, notice the place, and write in the area, not place of mitral valve, because anatomically is not the place of. It's area where you can find the best hearing, listening of this valve. Yes, in the fifth intercostal, in the area of mitral valve, I find out the third or fourth additional sound or murmur or some other kind of. Understand what you have to notice? Yes. So that's what you have to do with the heart. As well, my dear, it's not given here, but take your hand on this angle where the abdominal part is yeah. If you find here pulsation, you have to notice it as well and take in consideration in the future to compare, is this aorta or is it a heart problem of our patients. I understand, but not only arteries and heart muscle and heart valve we have to check. We have to check vein. Why? Because blood is going to the tissues, to the organs by the arteries and press here, but coming back to the thoracic side, to the heart from the veins, and jugular vein is one of the more common vein which takes the blood from the collect the blood from the tissue and take it to the right atrium perfectly, and then it is sent to the right ventricle from which it goes to the lungs. Yeah, so if we have here some problem with the atrium or regurgitation, maybe problem with the right ventricle as well, if we have some problem with the lungs and so on, you can think that here we have some problem of circulation of blood, of collecting of blood. So see this triangle between the muscles on the neck. Sternocleidomastoideus has 2 points of connection to the clavicle. Between them, you can find internal jugular vein. Understand? So now take patient by 45 degree. I want to show you here, if I will find my dear this picture. I want to show you. Once again, this is the cuspid, okay? Palpation. One moment, please. I want to find the copy. Okay. I think it's, yeah. So, let's see, my dear. Your patient, yes, here you can see, staying or sitting 90 degree. See how hard it is. So, high of venous pressure from sternal angle, my dear, see? If you are lying 60 degree and if you are lying 30 degree, not very deep changing exists here. These lines and these main points are on the same distance. Yeah, perfectly. So for the better organization of your patient, better to take patient in the angle between 30 and 60. 45 degrees, the perfect angle for patient to lie on the pillow perfectly, but flat pillow, which will not change the position, anatomical position, and flexion and extension of the head and vertebral column. Okay, see what we have to see. We have to find out this point where visual you will find pulsation. Yes, you have to light to take a perfect light here, light this portion and find out the pulsation here. If pulsation exists, and it exists for sure, but you have to check it very deeply. So find the most upper part of this pulsation. Okay, take the most upper part of the pulsation. See, and take some scalene, now how to scale, on the angle of your sternum. Take your hand on your sternum here, and you will find the sternum makes some angle. It consists of 2 positions, my dear. Where is it? Not here. I will find somewhere and show you right now, my dear. Excuse me. Somehow I miss it. That must be shown to you. Sternum. Okay. Here, my dear, on the picture, see, it consists from 2 parts, body and manubrium. They make here, on the position of second rib, some angle. By your finger, you can feel it on the middle part of your chest. Take it. Take from down portion up, and you will find this angle. This angle is named as well Lewis angle, my dear. So take here some ruler by the angle 90 degree to the sternum. Then take another scale, another ruler from the maximum pulsation point, and take it to your scale, to the ruler here, and find the point which is shown here perfectly. It will be 2 or 3, not more, and then summarize, take plus 5. Why plus 5? You remember here is 5 centimeter, yeah, of impulses. So you will not multiply, but take it in the sums here. So, and you will find if it is not more than 8 centimeters, that jugular vein pressure is normal. If it is higher, it means that we have pressure here. It's dilated, and pulsation comes from the more upper side, so it's not passed for good the blood in this vessel. Yeah, we have to notice it and take by patient to the some specific physician. So, definition of this examination: evaluation the pressure in the venous system as the blood is returned to the right side of the heart before is sent into the pulmonary circulation. Okay, then the procedure, test procedure. Patient lies supine and at 45 degrees, and we understand why. Yeah, the internal jugular vein is visualized as it ascends the side of the neck between the two heads of the sternocleidomastoid muscle. If the jugular vein appears to be distended, attempt to measure the height of the distension as a vertical column of blood in relation to the sternal angle. Test findings: a normal jugular venous pressure should not exceed 3-4 cm above the sternal angle. Higher reading may signify right side heart failure, constrictive pericarditis, pleural effusion, obstructed vena cava, and other pathologies of the heart and lung. Understand here how important it is. And the last, what is here consideration to help you visualize the jugular vein. Observe the patient neck when lying complete flat on the couch. Alternatively, placing pressure over the liver, hepatojugular reflux. So press of the point where the pressure is, and pulsation in the jugular vein will be more visual, increases venous return, and causes temporary jugular vein distension. Do not mistake the external jugular for the internal. The external jugular vein may appear engorged even in physiological states. Understand here? So, what else I want to do? I want to give you some video if I will find it. It's very easy, my dear. Come on. Okay, so my dear, I think it's all enough, all today, my dear. It's enough to understand the common portion of cardiovascular examination, my dear. So thank you for your attention. Read your books, continue connecting with me. If some problem exists, please write me in chat or on the mail. Thank you.